All right. Hello, 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 everyone. How are we doing today?
Great.
All right. Well, thank you for joining us today on National Women Girls HIV AIDS and Awareness Day. We are so excited to celebrate this day with you. HIV prevention, it starts with all of us, and we all must work together to end the HIV epidemic. My name is Krista Cochran, and I'm the program specialist for SWAV, Sisters with a Voice, a women's program of AIDS Atlanta. Before I jump right into today's events, I would like to introduce to you all the most extraordinary woman who makes all of this possible and sets the example of women-led leadership. AIDS Atlanta's very own Executive Director, Nicole Roebuck.
Good morning, everyone. I'm Nicole Roebuck, Executive Director of AIDS Atlanta, and I'm honored to be here on National Women and Girls HIV/AIDS Awareness Day and to welcome all of you to an exciting program announcement today. I want to start by first thanking Beverly Smith, Delta Sigma Theta National President and CEO Adrian Jackson, who is the president of the Decatur Alumnae chapter of Delta Sigma Theta. I also want to especially thank Shalitha Champion Booker from the Decatur Alumnae chapter, who is the liaison with AIDS Atlanta, and our Sisters with a Voice program, who you'll meet shortly. AIDS Atlanta is honored and pleased to be working with the Decatur Alumnae chapter of Delta Sigma Theta sorority. AIDS Atlanta has always prioritized women, especially women of color, in our ongoing fight against HIV and AIDS. We are committed to improving the health and quality of life of men and women across the board. But women have lots of times been a silent voice in this epidemic. And it's time that we amplify those voices. We at AIDS Atlanta know that when the woman is well, the family, community, and the society is well. This is why Janetta Richburg, our Director of Client Services, and Krista Cochran, our Women's Coordinator, have developed Sisters with a Voice, or better known as SWAV, to help women get and stay healthy. AIDS Atlanta had been looking for a partner to help us with wellness workshops and empowerment conferences, and we found a great partner in the Decatur Alumnae chapter of Delta Sigma Theta sorority. The Mighty Women of DST Incorporated have long been associated with us in helping with the AIDS Walk Atlanta, but I feel this new partnership will take it to another level by exposing our women members to the brilliance, power, and caregiving of the women of the Decatur Alumnae chapter. Thank you for all that you have done already, and thank you in advance for all that you will do for the women of Sisters with a Voice. Here's to healthy women.
Thank you so much, Nicole. National Women Girls HIV/AIDS Awareness Day is a day to share information and empower women and girls to learn about the importance of HIV and AIDS prevention, care, and treatment. But all of this cannot be learned in just 24 hours. Here at AIDS Atlanta, our women's program SWAV has collaborated with the Decatur Alumnae chapter of Delta Sigma Theta Sorority Incorporated. We are claiming 2021 as the year of the woman. The future is female. We are excited to highlight some community healthcare champions and to mobilize this day of empowerment into an even bigger campaign. We want to keep the momentum going all year long. I would like to personally thank a phenomenal woman whose commitment to service and dedication to HIV prevention and awareness has made this collaboration with Delta Sigma Theta Decatur Alumnae Chapter possible. Shalitha Champion Booker. She was unable to be with us today, but would like to share a few words. Speaking on her behalf is Dr. Natasha Hollis.
Thank you, Nicole. Thank you, Krista. Good morning, friends. My name is Dr. Natasha Hollis, and I bring you greetings on behalf of Shalitha Champion Booker, Chair of the International Awareness and Involvement Committee for the Decatur Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, who could not be here with us today. Through the International Awareness and Involvement Programmatic Thrust, the sorority harnesses its vast potential to strategically impact the plight of people across the diaspora. Throughout the years, we have impacted the lives of women and girls here and abroad, and today we are honored to join our friends at AID Atlanta and Sisters with a Voice to commemorate National Women and Girls HIV/AIDS Awareness Day. One of the 5 primary focus areas of our committee is World AIDS Day. With HIV infections on the rise in our community, and especially in our demographic of Black women, we decided to go beyond World AIDS Day and make HIV/AIDS awareness a year-round initiative in our chapter to educate, advocate, and mitigate. When we started this work for the Decatur Alumnae Chapter, it was at the peak of the epidemic in Metro Atlanta. It was at this time that Shalitha wanted to learn everything that she could, so she attended AID Atlanta's AIDS 101 Awareness and Action Seminar. While there, she ran into a friend and coworker who she had known and worked with very closely for years. Excited to see each other, they attended a few sessions together, and then during one of the breaks, she shared with Shalitha that she is an HIV survivor. She wasn't just there to learn more information like Shalitha. She was also there because she was ready to tell her story that there is life after HIV diagnosis. She wants other women to know they are not alone in this journey. At that moment, this work became even more important and deeply personal for Shalitha. She knew then we had to become more involved with HIV/AIDS awareness and with AID Atlanta. Since that time, the chapter's relationship with AID Atlanta has flourished. We participated as key volunteers and raised funds for several AIDS Walk Atlanta events. We helped to pack Santa sacks at Christmas to support Sisters with a Voice, and we happily continued our partnership to collaborate on this campaign to highlight National Women and Girls HIV/AIDS Awareness Day, all facets of women's health, and to empower women throughout the year through various engagement events. Our chapter members noticed our consistent and successful work in HIV/AIDS awareness, and in particular with AID Atlanta and with Sisters with a Voice. So some of them are here today to share their stories of health, advocacy, fear, and triumph. Next, you will hear from my chapter president, Adrienne Wright Jackson, a devoted committee member, Rochelle Jackson, and public health professionals and epidemiologists, myself, Dr. Natasha Hollis, and Dr. Shanta Rutherford. We are honored our friends at AID Atlanta and Sisters with a Voice Decatur Alumnae Chapter of Delta Sigma Theta Sorority Incorporated to help bring to you this National Women and Girls HIV/AIDS Awareness Day event. And 2021, the year of the woman, the future is female. Adrienne, I'll turn it over to you.
Thank you so much, Sora Hollis. Good morning to our sorors and to our partners of AID Atlanta and Sisters with a Voice. I want to formally acknowledge and thank you for this opportunity to bring greetings to you today. I am Adrienne Jackson, the proud president of the Decatur Alumnae Chapter of Delta Sigma Theta Sorority Incorporated, an organization founded on Christian principles focused on community service. Delta Sigma Theta Sorority Incorporated has a rich history of more than 108 years of service to the community. Our service foundation is built on our 5-point programmatic thrust: economic development, educational development, international awareness and involvement, physical and mental health, and political awareness and involvement. It is through the International Awareness and Involvement Thrust that the Decatur Alumnae Chapter forged its initial relationship and partnership with AIDS Atlanta. As participants, supporters, and fundraising partners to the annual AIDS Walk Atlanta, the Decatur Alumnae Chapter again has a very rich history with AIDS Atlanta, and we are elated to join with our partners, AIDS Atlanta and Sisters with a Voice, to commemorate this National Women and Girls HIV/AIDS Awareness Day. With current membership of more than 530 members, the Decatur Alumnae Chapter is grateful for this opportunity to serve with AIDS Atlanta and Sisters with a Voice to bring presence and a focus on this year's National Women and Girls HIV/AIDS Awareness Day. While we all work to survive in this pandemic, we are fortunate that platforms such as this one that we're on today have allowed us to continue our work and service to the community and allowed us to maintain and nurture our relationship with our partner organizations. Through our relationship with these organizations, I have personally been educated on the impact of HIV and AIDS with regard to women's health. Women, as we all know, sorry guys, are the backbone of society, and I am glad to be a part of this program focused on the health of women and girls. As a mother, grandmother, teacher, mentor, chapter president, friend, and soror, I know the demands that are placed on us as women. We make everyone a priority except ourselves. Today, you will hear from experts in their fields that will hopefully bring home the importance of women and girls focusing on their health, and this focus includes HIV and AIDS. The testimonials will be heartfelt and true. They should cause each of us to pause and reflect on how we should either redirect our attention to our own health or the health of a woman who is near and dear to us. In closing, I again want to thank AIDS Atlanta and Sisters with a Voice for allowing me to participate in today's program. I want to thank the sorors that are on the panel today for their participation as well. Sorors, Dr. Natasha Hollis, Dr. Shantae Rutherford, and soror Rochelle Andrews Jackson. I would also be remiss if I did not acknowledge our soror Shalitha Champion Booker, who is responsible for all of our participation and presence here today. I'll ask that you all keep her and her family in your prayers as they deal with the recent death of someone in her immediate family. Thank you all again for joining us in this National Women and Girls HIV Awareness Day event, and enjoy the program. I will now turn the floor over to Decatur Alumnae Chapter member, soror Rochelle Andrews Jackson. Thank you.
Thank you, Madam President. Good morning, AIDS Atlanta, Sisters with a Voice. I see my soror Shalitha Champion's picture here, and I'm smiling to see her here. And all of you, good morning again. I am Rochelle Jackson, and I must say that I received my first HIV/AIDS test on site at an event, World AIDS Day event, sponsored by Decatur Alumnae Chapter, International Awareness and Involvement Committee, our own chairperson, Shalitha Champion Booker, and I was there. I sat and listened to strong, vibrant women from different walks of life and different ages. They were so professional and knowledgeable about their health and encouraging others to be tested for their own health. They shared their journey living with AIDS and HIV. They were survivors, thriving and living productive, successful lives. After listening to these survivors and watching their enthusiasm to educate others toward a healthy lifestyle, it inspired me to step up and be tested. I must say, soror Champion Booker took the first step to be tested, and I followed her. There was fear, nervousness, and questions in my mind. What if at 60 plus? What next? I talked throughout the procedure, and the needle prick didn't even hurt. This was my way of handling this new me, and I was relieved with the negative results. After I left the event, I did encourage my 2 sons to take the HIV/AIDS test ASAP. As a senior 70 plus, I am serious about living a healthy lifestyle and continuing to age gracefully. I exercise daily. I walk my Maltese at least 30 minutes a day, every morning, and try to eat healthy. I take no prescribed medications, and I am living and loving life every day in order to remain mentally, physically, and socially healthy for me, my family, and my grandkids. Thank you, HIV/AIDS, for having an impact on my life at that event and from henceforth out. I thank you so very much. I wish you much success in your endeavors, and I will be there to support any efforts that you are going to have. Be blessed and stay safe. Thank you.
Thank you, Sora Jackson. Greetings again, everyone. Just to reintroduce myself, I am Dr. Natasha Hollis. I am a public health epidemiologist in the federal government. My passion to reduce health disparities and promote health equity fuels the work that I do in public health. In order to ensure that everyone has the same access to and quality of health, healthcare, and life, we must first address the areas and issues that lead to these differences. Throughout my career, I have focused primarily on work as related to disproportionately affected populations in an attempt to gain a better understanding of factors that contribute to disease and health outcomes and conditions within affected populations, because only then can we tailor interventions to reduce the gap that we see in health disparities. Women, children, and racial and ethnic minorities have been the primary focus of my career, spending approximately at least a little bit over half of the last decade working in and around HIV/AIDS, both domestically and internationally, chronic conditions and diseases, as well as interventions and prevention of chronic conditions. In the US, while Blacks account for approximately 13% of the population, Blacks account for nearly half of all new HIV diagnoses. Among Blacks, most new infections occur in men. However, the highest transmission category of new infections among Black women is due to heterosexual contact. In the general US, women account for nearly 20% of all new HIV diagnoses. Among new HIV diagnoses in women, the majority are in Blacks at 57%, white approximately 21%, and Hispanic Latino around 18%. In this year, 2021, the year of the female, the future is female. It is important that we, as women, prioritize our complete health and well-being, including physically, mentally, and emotionally. And for those where it applies, spiritually as well. Women are often recognized as go-getters, the glue holding families together, ensuring things work smoothly on the job, and sometimes serving as a counselor and a listening ear for others without regards to oneself. However, we must remember ourselves in the midst of wearing multiple hats and practicing self-care. You can't pour from an empty cup, so you must first take care of yourself. Then, in this year of the women, let us empower ourselves and one another, achieving the impossible, overcoming the obstacles, and excelling in every facet in life. Optimal health is a fundamental right that should be available to all in every community. I am a member of the community to which my work supports. Thank you. Now I turn it over to Sora Dr. Shanta Rutherford.
Good morning, everyone. Thank you, Sora, Dr. Hollis, for that poignant facts, and research. Thank you so much. Good morning. I'm Soror Dr. Shanta Rutherford, and I'm a public health epidemiologist for the state. I truly believe that everyone desires the right to a great quality of life. It's a necessity, it's a requirement, it is an entitlement that is owed to us as a basic human right. My passion is to continue to educate, inform, and help in reducing and eliminating health barriers that affect all human beings. And in my work in public health, it allows me to be that facilitator of change for the community in which I represent, and that is women, but most importantly, women of color who are disproportionately affected by HIV/AIDS. As Dr. Hollis stated, she gave you statistics from the U.S. nation perspective. I'm going to give you some statistics from Georgia. For years, we have seen that Georgia has been at the top of the state with the highest rates of HIV/AIDS cases. And as of December 2019, we saw that 58,594 persons were living with HIV. Of those, 75% were male and 24% were female. Of newly diagnoses, we see that there's 2,504 persons in Georgia with newly HIV infections. And among those that were diagnosed at 13 and older, 19% were female and 90% were attributed to heterosexual sex. What does this mean for us? We all know, as stated previously, as women, we wear so many hats. We're mothers, we're sisters, we're teachers, we're part of organizations, we're church members. And at times, we do not consider our health a priority with added responsibilities. And in the state of Georgia, we see that Black women HIV rates have decreased, but we still have a long way to go in making sure that we eradicate HIV amongst women of color. So when you think about HIV, you have to think about the barriers that may be faced by women in the state of Georgia. We see that sometimes women of color have a high rates of poverty, socioeconomic status, cultural stigma, and access to quality of care. So for example, if I'm a female who is HIV infected and I have a transportation barrier, how can I get to my appointments to make sure I access my great quality of care or talk to my medical professional about what's going on with me? Or if I have some mental health issues going on, how can I get there if I have a transportation issue? Or if I have a housing barrier, I'm going to be more concerned about where I'm going to lay my head at night instead of maybe going to my doctor's appointment. Or if I have lack of housing, how can I properly store my medication? Those are some of the things that we need to think about when we think about HIV prevention and resources when it comes to help curbing the HIV epidemic. Not to mention that sometimes these barriers deter women from seeking professional help or going to their medical appointments. And sometimes it's due to lack of support, stigma associated with being HIV infected. And even though we're hit the hardest, we must find ways on curbing this event so that we can see us achieve a great quality of life. So when it comes to voting in your state and city election, we want to make sure that we are electing candidates who are speaking the words that we want to hear. We want to hear the candidates talk about expansion of Medicaid and lower prescription and making sure that federal and state funds continue to go to community-based organizations and health entities that are helping HIV-infected women and children and men achieve a great quality of life. But most importantly, as Dr. Hollis stated, we must tailor prevention programs that will help with this. And also we have to address other contributors that may be a factor in why women do not get tested and why they may not disclose their HIV status to other people. We have to think about violence, educational disparities, oppression of women, sex trafficking, health inequalities, and cultural traditions that place young ladies and women at risk and address economic policies that magnify these disparities. It's also important for us who work in the field of HIV/AIDS that we are informing our clients and HIV-infected women about the Round Right program for those who may not have access to health-related insurance, making sure that, as I stated previously, we're voting in our local and state elections, and making sure that we're talking about preventive services such as pre-exposure prophylaxis, and making sure that when we have advocacy boards for HIV/AIDS prevention and Ryan White advisory boards, that there's a great representation of women. As women and sisters, we should always encourage one another to get tested and to make sure that we're making our health a priority. Because if we don't care, who will care? Let us continue to be that beacon of light, to use our talent to give voice, dignity, respect, and value to the voiceless, powerless, and the faceless of millions of women who are infected with HIV/AIDS. Let us not lose sight of the opportunities to mentor young ladies to women and to create a strong generation who will continue our advocacy efforts. Teach one, reach one, and let us continue to be our sisters' keepers and holding each other accountable for our own health. Thank you so much for having me.
Such powerful, powerful words. Thank you, ladies. Thank you all for sharing your experiences. Thank you for sharing your knowledge with us today. You give women from all walks of life hope, courage, a reason to not give up when the going gets tough, because better days are coming. My hope is that this campaign will touch the lives of many, whether you're diagnosed and living and thriving with HIV, impacted because you know or you knew someone with HIV, or you want to become more knowledgeable and teach others how to protect themselves to prevent HIV. Please do not let this day end when you go to sleep tonight. Join us in our campaign. Become a healthcare champion for yourself and for the ones you care about most. In the coming weeks and months, we will be hosting events that will focus on how we will achieve a pro-woman future. Topics will include, but are not limited to, professional development, self-care, beauty, fitness, empowerment, and engagement. A huge thank you to our clients, staff, community members, Delta Sigma Theta Decatur Alumnae Chapter, and Aid Atlanta's development team for all of their hard work and dedication to seeing this campaign take off. Thank all of you for joining us today. We appreciate you taking the time out for our campaign lunch and hope to see you out there in the community being a healthcare champion. Please follow us on Facebook at SWAV Aid Atlanta and Instagram at SWAV Aid ATL. This campaign will also be available on our Aid Atlanta YouTube page, so don't forget to like, subscribe, and share. If you know anyone who is in need of HIV and STI testing or other services, please visit our website at aidatlanta.org. Bye, everyone.